All right, good afternoon. Thank you so much for joining me in my presentation on what mental health practitioners need to know about ending the HIV epidemic. My name is Dr. Rosina Britton. And so today on the agenda, we'll be talking about basic information concerning HIV. We'll talk about what PrEP and PEP actually is, and then some limitations of PrEP and PEP, and who are long-term survivors. We'll also talk about ending the HIV epidemic. We'll talk a little bit about stigma, and then we'll talk some more about HIV/AIDS advocacy and using a socio-ecological model. So a little quick disclaimer before we get started. I just want to let you know, although my credentials say that I am a PhD or a doctor, I am not a medical doctor. My PhD is in counseling, education, and supervision. My dissertation and my research interest is within HIV and AIDS, and I do have the basic knowledge of HIV/AIDS, and so that's what I'm here to share with you today. I do not have all the answers to how we can end the HIV epidemic, but I do want to inform you about what is there and what's out there, what's being discussed as far as policies are concerned, and what ways that counselors and mental health practitioners can actually contribute to this movement. And lastly, if there's any additional information or resources that you have, please feel free to share them with me. I'm a lifelong learner, and I am willing to accept all information concerning this topic to help myself become more aware and informed about this. All right, so quick information about HIV transmission and how to reduce the chances of getting HIV. Although we are currently in 2019 getting ready to start 2020, we still have some stigma surrounding and misconceptions surrounding HIV. So I just wanted to go ahead and give a quick reminder and a brief information about the transmission of HIV, and that it's usually spread through bodily fluid from a person who has HIV, and that bodily fluid can include blood, semen, preseminal fluids, vaginal fluids, rectal fluid, and breast milk. In the US, HIV is spread mainly by having anal and vaginal sex with someone who is HIV positive without having a condom or taking medicine to prevent HIV. So for those of you who are mental health practitioners, if you happen to have a client who is HIV positive or at risk for HIV, you definitely want to encourage your clients to get tested and to know their partner status. Getting tested before you encourage clients to get tested before engaging in sexual practice. The CDC recommends that everyone aged 13 to 64 get tested for HIV at least once. But recently, new data released on the National HIV Testing Day has shown testing rates are far too low. HIV testing is one of the 4 key strategies for the proposed ending the HIV epidemic, a plan for America. And that is part of this ending epidemic. We need to make sure that people are getting tested for HIV. The next thing is to choose less risky behaviors, encouraging your clients to use condoms and to limit their number of sexual partners. And the more partners you have, more likely you are to have a partner with poorly controlled HIV or a partner with a sexually transmitted disease. These factors can increase the risk of HIV. Again, getting tested is very important. And not only just for HIV, but for other STDs as well. And also encourage your clients to talk to their healthcare providers about PrEP, and we'll talk a little bit more about what PrEP is in the next few slides. And then lastly, encourage your clients to not inject drugs, but if they do, please make sure that you remind them to use sterile drug equipment and water, and never to share equipment with others. So pre-exposure prophylaxis, also known as Truvada, is a means to prevent or control the spread of infection or disease. PrEP is for people who don't have HIV but are at high risk of getting HIV, and to take the medication every day to reduce their chances of HIV infection. The HIV medication is used, again, it's called Truvada. If a person is exposed to HIV through sex or injection drug use, having PrEP medication in the bloodstream can often stop HIV from taking hold and spreading through the body. However, if PrEP is not taken every day, there may not be enough medicine in the bloodstream to block the virus. So it's very important to maintain and take the medication frequently in order for it to be effective in blocking the HIV transmission. Post-exposure prophylaxis is a medicine to take soon after possible exposure to HIV prevention, to prevent HIV from becoming affected with HIV. PEP is used, for example, for a person after having sex without a condom with a person who they may believe is HIV positive, or after a healthcare worker is accidentally exposed to HIV in the workplace. In order for PEP to be effective, it must be started within 72 hours. So that's 3 days after possible exposure. And PEP involves taking the medication for about 28 days. So all of these medical advancements are wonderful. However, just like any medication, there are side effects. People with HIV are likely to have type 2 diabetes and are at risk for and taking medication. Some of these medications may increase their risk of type 2 diabetes, high cholesterol, inflammation, and also mental health concerns. So while some of these symptoms can be manageable, some of them tend to be a little bit more serious. There are benefits. The benefits definitely outweigh some of those side effects, because it's going to continue to improve, and if they continue to take the medication, they'll start to have less symptoms. Unfortunately, people who have HIV are more likely, again, to develop other medical conditions, or taking medication can increase the risk of additional side effects that some HIV medication may have. So while doing my dissertation, I learned a lot about the HIV community. And one of the things that came up was long-term survivors. And I hadn't heard this term, and it was really interesting to me, and I wanted to share this with everyone, in that we are wanting to end an epidemic on HIV, and it's great. But I also want to call attention to those who have survived the epidemic, and those are individuals who are known as long-term survivors. And these are people who lived during the time in the early part of the epidemic that witnessed many loved ones, friends, and family who died of the disease. And so it's important that we consider them too during this time. A long-term survivor is a person who has been living with HIV before the medical advancements of HIV medication and living through the epidemic. It also refers to a person who has been living with HIV, more specifically someone who has been living with HIV since 1996. And there's a prenatal infection population too, who are considered long-term survivors, and these are individuals who were born with HIV or acquired it at a young age. And then there's HIV negative long-term survivors, which is a person who is a partner, companion, activist, and healthcare provider who directly supported people living with HIV in the earlier days of the epidemic. And I personally take on the identity of being an HIV negative long-term survivor, in that my mother and father passed away from HIV/AIDS complications, and to me, this is so important to remember the people who have survived the epidemic that we're trying to end. And there's a growing population of people that we will serve at some point. And so becoming knowledgeable about this population is really important. I got some more information from the worldproject.org and talking about this. I do feel as if this is a need to call to the attention of mental health practitioners, and that we can understand this as an additional culture that's happening with HIV. So one of the issues that was mentioned to me within my study, one of my participants actually said that there is a shift in how people view HIV based off of being a long-term survivor and having recently had been diagnosed with HIV. And it was really interesting how he talked about this, my participant in my study. He said that those who are long-term survivors tend to have more of a serious reaction to HIV and the HIV epidemic. The newer generation that is becoming impacted by HIV are treating it, and these are his words, as a common cold. A lot of times when I was talking to some of the professionals that I was interviewing for my study, they said that it is almost, HIV is almost now at the level of being compared to diabetes, whereas you may have diabetes, and it could lead to death if not taken care of properly, and the same thing with HIV. But if you take care of yourself, you take the right medications, you can survive, and that's pretty much the case with HIV at this point. And because of that, those who were experiencing the epidemic a lot earlier really saw the effects and seeing people die from the epidemic. That is why they have a little bit more of a sense of seriousness surrounding the importance of protection, medication management. However, being a long-term survivor means that they have had an experience, a series of medications that they've probably have tried or have taken at some point. And so there's a concern for treatment fatigue, which can cause a little bit of difficulties with adhering to medication. This was another topic that was discussed in my interview with some of those participants, because the issue and concern was if someone stops taking the medication regularly, for a certain period of time, the body will no longer receive it. The body's resisting the drug, and more so the HIV virus is going to start to be able to resist that drug and multiply within the bloodstream. And so the drugs and medications are meant to block it and to prevent it. And so if that happens, that means that that drug is no longer effective. They have to stop that set treatment and then move on to the next type of treatment. And after so many, someone could potentially run out of medications that will become effective. So that's something else to consider with some of the medications that are coming out. Unfortunately, again, long-term survivors tend to go through multi-drug resistance, making some effective treatment difficult to find. So the U.S. Department of Health and Human Services has proposed ending the HIV epidemic, a Plan for America initiative to end the HIV epidemic in the United States. And it's supposed to be something that is proposed for HIV to be limited or to be reduced by 90%, new HIV infections to be reduced by 90% within the next 10 years. The initiative would leverage critical scientific advances in HIV prevention, diagnosis, treatment, and outbreak response by coordinating with highly successful programs, resources, and infrastructures. The CDC will work closely with state and local governments for people who are at risk of HIV, as well as federal partners to coordinate efforts to expand the highest impact of HIV prevention strategy, which is to diagnose, treat, prevent, and respond. In the first phase of the Ending HIV Epidemic, it aims to infuse additional resources such as technology and expertise that will scale up, and their plan is to use the 4 strategies, which are the diagnose, treat, prevent, and respond. The community involvement was one of the key things that I saw as an important part, and where counselors and mental health practitioners can contribute to the ending of the HIV epidemic. Because they're looking to include new and diverse partners and building upon community experience, that would include SAMHSA, so the Substance Abuse and Mental Health Services has continued to be a partner with a federal partner in assisting with high-risk individuals for contracting HIV, and prevention through PrEP programs were made available to individuals without insurance. SAMHSA has been committed towards this health crisis and has been a longstanding partner with this, and in generating past products focusing on HIV, such as TIP 37, and also developed a new social media resource that's called the New HIV Prevention. And so with the epidemic and the plan calling for new diverse partners, I see this as an opportunity for mental health practitioners to step in and to provide resources and opportunities for those who are surviving HIV, and ways that we can help our clients in understanding how to prevent the spread of HIV. So one of the things that I realize can limit the ability to end the HIV epidemic initiative is stigma. Stigma is still a huge issue surrounding HIV/AIDS and has contributed to assumed behaviors that are associated with HIV transmission, such as sexual activity and drug use. Because HIV is often spread through sexual contact and sexual intercourse or drug use, a large portion of Americans regard people living with HIV as degenerates and blame them for their illness. Additionally, irrational fears of contamination have deprived many people living with HIV of adequate care and even basic human contact. One of the stories that I think about that was shared with me during the interviews for my study, was a practitioner having a client who was wanting to schedule a dentist appointment who was HIV positive. The individual had finally accepted their status and was comfortable and wanted to use this opportunity in disclosing his status as a form of empowerment. And so the individual filled out the intake form, got everything set up, and he mentioned that he was HIV positive, submitted the form, and received notification that he would not be able to be seen because they were fully booked, and there was no appointments made available for him. And so my participant advocated on behalf of his client by calling the dentist's office and telling them that what they were doing was discriminatory, and that is not okay, that they should be still willing to see his client. And he spoke up on behalf of his client. And even though, again, we're in 2019, there was another instance where stigma affected someone's ability to get adequate quick care within an emergency room. Another participant stated that his client went into the emergency room. Of course, he disclosed that he was HIV positive. doctors, nurses that entered the room came in with face masks and talked with him. They weren't doing examinations, they were just talking with him, and they had on a face mask. And so that just goes to show that they still had this misconception of how HIV is transmitted, even within the medical field. And of course, you know, the client came back to the mental health practitioner and explained this experience. And he said the words, and this is a quotation from the interview, "I felt like they were treating me as if I were a leper." And that's just really sad when you think of someone going in for an emergency visit, that this is an emergency. And then the client said, again, a quote, that if I don't feel safe going to these places, then who can I trust? So because of this irrational fear that medical practitioners have, this may limit the effectiveness of ending the HIV epidemic. But our goal is to change that narrative. And so if we as practitioners can change that narrative within our practice, within our profession, I believe that can be a good start. And then also with encouraging our clients to take preventative actions is also a good start for us as a profession. So what can practitioners do? Here, this is an image of the multicultural social justice counseling competencies in a diagram. As you know, social justice and advocacy are the core components of the counseling profession. And so this is a framework that was implemented from the multicultural and social justice competencies. And this is something that I use as a foundation, as a theoretical foundation for my study. And I feel as if it can still be a good foundation in encouraging counselors and practitioners and how to be effective social justice advocates. And so this conceptual framework is an illustration and a visual map of the relationship between the competencies and the social constructs here. So the quadrants are used to highlight the intersection of identities. And so you have privileged counselor, marginalized counselor, you have marginalized client and privileged client. And this can fluctuate and can change given the person that may be sitting in front of you at any given moment. And so this is really a good example on how that actually can look on a diagram, how that can change at any given time. And then what this does is that it shows the dynamics of how power, privilege, and oppression can influence the counseling relationship. The developmental domains are also layers that go into the multicultural and social justice praxis. And those developmental domains are counselor self-awareness, client worldview, the counseling relationship, and the counseling advocacy and interventions. Embedded in the first three developmental domains are the aspirational competencies. And so that is looking at the attitudes and beliefs, knowledge, skills, and action. So I'm going to give you a few examples here of these, and then I'm going to connect it to what we can do as far as adding to the HIV, ending the HIV epidemic. So the MSJCC shows the privileged and marginalized counselors intervening with and on behalf of clients at the intrapersonal, the interpersonal, the institutional, community, public policy, and international global levels. And so the intrapersonal intervention is addressing the impact and attitudes and behaviors and developmental history of a client. The interpersonal intervention is addressing the effects of groups that provide the client with identity and support. The institutional intervention addresses inequities at the institutional level. community interventions address norms, values, and regulations of a community that may be empowering or oppressive for a client's growth and development. And then public policy interventions address public policies that impede on clients' development and on behalf of the client. And then international is a global intervention that addresses international global events, affairs, and policies that impede on the client's development and on behalf of the client. So what does that look like for a mental health practitioner and their interventions for HIV prevention? So intrapersonal can include employing empowerment-based theories. These are theories that are multicultural and consider different cultural aspects of a particular individual or client. And so that would be the same type of theory that you would use for an individual who may be presenting as HIV positive. This is also to help clients develop critical consciousness by understanding their sexual risk behaviors. And so being able to help a client understand what behaviors actually contributed to their current circumstance is also beneficial in intrapersonal intervention, but also HIV prevention. Making them aware of their sexual risk behaviors may decrease their continuing behaviors, and which would reduce the potential chance of HIV spread or transmission. And also the interpersonal intervention can assist clients with developing self-advocacy skills that promote sexual health, such as when to negotiate condom use and how to negotiate condom use, as well as encouraging their partners to get tested and to request that they know their partner's status. Interpersonal interventions is to help the client examine their relationship with family, friends, and peers. So one of the things that my participants also mentioned was this need for belongingness. Most individuals who learn of their HIV status tend to be ostracized. And so it is important to help clients feel empowered to reach out and collaborate with family, friends, and peers to be a source of support, and where to find support if they don't feel as if they have that. This is also interpersonal interventions will also help the client develop communication skills to discuss these issues and sometimes even some of the stigma that they're experiencing from other people, and to talk about that, empower them to talk about that with their family, friends, and peers, and even have some of their family, friends, and peers' behaviors towards them with their HIV status can also contribute to this stigmatized narrative. And so with doing that, you're increasing HIV awareness and helping the client increase their HIV awareness, but also in HIV prevention, because it's now something that you're encouraging your client to talk about and to advocate for themselves. Institutional interventions for HIV prevention includes connecting your clients with supportive individuals in social institutions, such as schools, churches, and businesses. These are places that you are well aware will accept and protect the individual, that gives them a safe place to be. And so connecting them with the proper resources is an institutional intervention that will help with HIV prevention. Removal and address systemic barriers experienced by clients in social institutions. An example of that would be when a participant in my study shared with me that even the institution that he was working in and providing counseling for people who were HIV positive had a barrier. And he was able to acknowledge that there was a barrier that was made for clients because of how they were doing their intake. So there was a window of time that they gave clients an opportunity to call in and set appointments for mental health and HIV testing. The time was something between 8:30 and 10:30. And so if clients could not call between that time, they could not be seen. And so that caused a barrier. And so what the participant did was he created a whole new program that would allow people to call directly into the program and to establish appointments and whatever else other case management needs that needed to happen with him, separate from the institution. That he was still under the institution, but he created a way for those who needed services. He created a way for them to get the services they needed. And that is just one example of how to remove a systemic barrier, or to how to address it. Again, going back to that example of the practitioner who, called the dentist office and said, hey, what you're doing is discriminatory, it's not okay. And that's addressing the systemic barrier, because that dentist office was not willing to see that client. That was a barrier of healthcare for that individual. And so it seems large, and it seems like you have to do something grand and wonderful, but sometimes it's just the simple steps and the simple things that you can do to help with institutional interventions on behalf of your clients. And to conduct multicultural and social justice-based research to highlight inequities and experiences by clients living with HIV, which is what I did with my study. And I'm hopefully continuing to establish webinars and information that helps people become aware of the issues that are surrounding HIV/AIDS. And while it may not be seen as an epidemic anymore, we're on the level and at the point of ending the epidemic, there are still issues that are not being addressed in this. And so while we are doing what we can as a nation to get the epidemic under control, we still have to kind of create a safe net for those who are not being served, even with ending this HIV epidemic. Community interventions for HIV prevention is taking initiative to explore current HIV intervention and prevention programs within your city and county. There may actually be programs established, and so as practitioners, especially if you're working within a community agency, it's important to become aware of those programs and initiatives that are local for you. So that way you can provide proper resources to your clients, especially those at risk. Connection with public health departments is also another way with creating community intervention. This is an example of how you can connect with the public health and offering counseling services to those with HIV on a sliding scale. And this will provide you an opportunity to give back to the community, as well as advocating for the individuals living with HIV and providing them mental health support, especially those who are long-term survivors. Long-term survivors are dealing not only with medical comorbidities, but then may also be experiencing mental health concerns as well. And also to consider that there is an AIDS survival syndrome that maybe they are experiencing, and how to navigate that. And so while we're wanting to end the HIV epidemic, we also want to create a safe space for those who have survived the epidemic as well. Public policy intervention for HIV prevention looks for me as being a way to engage in social actions that alter local, state, and federal laws and policies at the expense of people living with HIV. When I think about laws, I think about Illinois. And I read recently that there's a lot of states that have laws that if someone who is HIV positive does not disclose their status before sexual contact could potentially face federal, what is it? They could have, it could be like seen as oh man, I'm forgetting what it's called right now. But basically, it's an extreme law that if it could be like murder in some states. And so because of that, there's a need to change how these laws are because it criminalizes HIV. Whereas now that we've come so far with medication advancements, it is a discrepancy because someone who is HIV, who may have an HIV virus, could be taking medications regularly and their viral load can be reduced. And because their viral load is being reduced, it's called undetected. So U equals U is, it's undetected, so therefore it is untransferable, and so untransmittable. And so if a law is criminalizing someone for not disclosing and their HIV, even though they have the HIV virus, but it's so low it's undetectable, that could still put someone in a little bit of a crisis with the legal system. And so becoming aware of things like that, becoming aware of your state laws, especially for when you may experience a client who may disclose that they're HIV positive and engaging in sexual risk behaviors, when is it your duty to actually warn third parties? Again, you have to consider the viral load in this situation. And so again, becoming aware of what state laws are, what local law, what your federal laws are concerning HIV is very, very important. Again, if you're working within the agency or a clinical setting, what are some ways and discover some ways in which you could actually employ the Ending HIV Epidemic initiative. And so that is all I had for you today. Again, I just wanted to encourage you all to be made aware of the HIV epidemic, to understand how you can contribute to ending the HIV/AIDS epidemic as mental health practitioners. And I hope that the use of the multicultural and social justice competency guide was helpful in understanding the many different areas in which you can help encourage this HIV prevention and intervention initiative. So thank you so much for joining me. I appreciate your time. And here are a few of my sources from the CDC, SAMHSA, and the wellproject.org, as well as the RATS and colleagues multicultural and social justice counseling competencies. Thank you so much for your time, and I will be seeing you all soon. Thank you.